Dr. Pat with Little Critters, and we have Shelly here, little 2-year-old bantam hen. And Shelly has been presented today because she's been a little lethargic. The other hens have kind of been picking on her, and the owner had noticed some abdominal swelling. You can see when she's standing, her wings are a little bit droopy, her tail's down a little bit, just not acting as bright and alert as she should be. Shelly has salomic fluid or fluid in the abdominal cavity. Birds don't have a separate chest and abdominal cavity. It's one big cavity called a coelom, and she actually has fluid filling up in that cavity. When you look at her bottom, and she's got urates on her bottom, so we're going to clean this up. When you look at the bottom, particularly down here where my fingers are, if you look down here, this abdomen should be convex. It should curve upright. If you notice, it's actually pushing out. It's curving downward. When we press on it, we can actually feel some fluid in there. Now, they can look like this sometimes if they're egg-bound or have dystocia. There's an egg, but there's no firm structure palpated here. It feels like fluid on palpation, and so the suspicion is that she has reproductive disease. They can get ectopic eggs in a variety of reproductive diseases. It causes internal inflammation, and that inflammation leads to fluid buildup in their abdomen. Typically, we recommend x-rays to make sure there's no eggs higher up or broken eggs or further pathology so we can see what's going on inside, and we usually get basic blood work like a CBC and blood chemistry. This is a very, very common problem in heavily reproductive hens. And what we're going to do today is get her bottom all cleaned up, and then we're going to do a centesis where we actually stick a needle into this fluid-filled swelling and see if that is in fact fluid in there. And if it is, we're going to draw off as much of that fluid as we can. That doesn't cure the problem, but does alleviate some discomfort and makes her feel better. The problem is if there's reproductive disease, it's diffusive and she will continue to fill with fluid. That's Shelly. So we've got a little bit of work to do on her, trying to get her feeling better.